it's open to where they're coming in.
Good morning. We're just letting a few more people trickle in and then we'll get started. All right. Well, good morning, everyone, and welcome to the McGill Dementia Education Program's Caring Conversations. This is a free community outreach initiative that provides virtual support to care partners of people living with dementia. So our program offers a comprehensive range of free resources to educate and support people living with dementia, family and informal caregivers, healthcare professionals, medical students, and the public at large. One of our important resources is Dementia, Your Companion Guide, which is available online for free in 10 different languages. You can also obtain printed copies at Amazon. You can also find answers to many of your questions in the extensive library of McGill Care's webcasts and podcasts. We now have 95 webcasts available to view online at your convenience. Caring Conversations is an initiative of the McGill Dementia Education Program and is supported by the Petro-Canada Caremakers Foundation. So our facilitators today are Lucy Barylak and Joanne Besner. Lucy Barylak received her Master of Social Work from the McGill University School of Social Work. She's developed evidence-based training for seniors and caregivers, and she's lectured in the field of social gerontology and presented at major conferences. Her research studies have been published in numerous journals. Ms. Barylak received the Queen's Jubilee Award for her role in developing a national coalition to support caregivers across Canada. Joanne Besner is an educator, professional coach, and caregiver. She received her Bachelor of Social Work and Master of Business Administration from McGill University. Her 35-year career in public community healthcare in Quebec spans many roles, including frontline case manager, clinical supervisor, manager, researcher, and trainer. So you can see that you're in very good hands today. So the topic today is hygiene and dementia. Lucy and Joanne will discuss what caregivers of people living with dementia can do when the person they support refuses personal daily care. So we would ask that you please keep your microphones turned off. We'll unmute people as needed once we open up the discussion. We also want you to know that this webinar is being recorded and will be posted on our website. At the end of the session, we'll stop the recording so that anyone who would like to discuss more openly and turn the cameras on will be able to do so. So we'll let you know at that point in time when we turn the camera off, and we'll also have a short break at that time. So please go ahead, Joanne and Lucy. Thank you.
Good morning, everybody, and thank you, Diane, for that warm welcome. Lucy and I are so thrilled to be here for a second season of Caring Conversations. And we're opening with one of our tougher topics on hygiene. So what can caregivers do when the person with dementia refuses daily care? And the reason we decided to start with this topic came specifically from a letter that Lucy received entitled, Dear Lucy, and I'm going to share it with you. Dear Lucy, my husband was diagnosed with Alzheimer's 5 years ago. I'm his primary caregiver and happy to do so. In general, George is a very calm and gentle man. I assist him in all his activities. However, in the past few months, it's become really difficult to care for George with his hygiene. He's refusing to bathe, change his clothes, and refuses to brush his teeth. I'm getting so angry with him that I just want to give up. I don't know what to do or where to get help. I took him to his doctor, who said simply, the dementia has progressed and I need to find new ways to assist my husband. I'm in my late 70s and I find it very difficult, especially when I get angry. I feel so sorry for yelling at him. Please help. So today's session is going to respond to this letter and some of your similar experiences. And we do hope and ask you that because this is Caring Conversations, that you feel free to share with us and share with your fellow caregivers what you are going through. And as Diane said, you can do that through the chat. And if you feel comfortable, just raise your hand or unmute yourself and join our conversation. What we're going to cover today are the following: bathing, dressing, oral care, foot care, hair care, and special tips for men and special tips for women. We have a lot of information to share with you, but we are going to respond to your needs. So if we don't cover everything today, the presentation will be on the website with all the details for you to consult at a later date. So to understand why some people with dementia display difficult behaviors, especially when it comes to daily hygiene, we need to remind ourselves what's behind this disease. So just a word on dementia, reminding ourselves about the symptoms and that this affects our brain, not just memory loss, difficulties with how we think, problem solve, and language. It affects mood and behavior, an overall general reduced ability to perform your basic everyday activities. And we need to remind ourselves that these symptoms are irreversible. So we might be talking about a behavior that's always existed or a brand new situation that as a caregiver you're now facing. When a person with dementia is unwilling to do something that we want them to do, we usually use words to describe them as resistant, they're refusing, they're difficult to manage, they're stubborn. And just like these words, this can make you really angry and really frustrated, and we certainly can understand why, especially with what you're going through in your 24-hour day. However, as with any other areas of a person's behavior that we find challenging, we need to find out what is the person telling us through their refusal. In other words, why? Why are they refusing? And rather than expecting a person with dementia to follow our wishes, we need to focus on how we can cooperate with their wishes. So it's a little bit of a different perspective. So when your person might be either verbally or non-verbally communicating that they don't want to do this, they might say it or they might just gesture or push back. We need to discover why. And so here's some possible reasons why. Maybe they are in pain. There may be something medical going on that you're not aware of. Maybe they don't understand what they're being asked to do. And the request doesn't always fit into their standards or actually what they want to do. For example, we may be asking them to eat something they don't like or to go to bed when they don't want to. They may want to stay up, especially if they're in the early stages of dementia. They may feel like they're being talked down to or bossed, and they're refusing in order to keep some kind of sense of control. The person could be misinterpreting the situation or environment and perceive, for example, a shiny floor as being wet and all of a sudden refuse to walk on it. They can't tell you why, and we have no idea that they're feeling that way. They may be tired, they may be hungry, they may need to go to the bathroom. There could be so many other reasons. They may refuse to fit in our daily routine. And we can choose, though, to see this as a positive sign, especially in early dementia, where they are still retaining their own sense of identity and autonomy, and they want to maintain some control over their lives. So it's very beneficial for them and for us to maintain their autonomy and dignity. And we're going to come back to the word dignity today, because in hygiene, it is so important. People with dementia, remember, yes, it's irreversible, but they have good days and bad days. And it's so important to recognize, how is your person feeling that day? Maybe if they're having a bad day that day, it's just not a good idea to even commence and give them a bath or shower. And if you're not having a good day, maybe it's equally not a good idea. Personal care is a very intimate activity, and most people would have difficulty, with experiencing these feelings anyway if they need help with hygiene. Look at our roles. Just because we are there to help, were first and foremost either a partner, a wife, a child, a sibling, and this role wasn't part of the deal. So trying to force a person with dementia to accept personal care can almost be seen sometimes as abusive if we're forcing them. But on the other hand, neglecting giving them that personal care can also be seen as neglectful. So what does a caregiver like yourself do, and how do you move forward? So I'm just going to pause for a second and just remind you that if you're sharing these feelings or this is bringing up emotions in you, please feel free, just add it in the chat, and Diane or Maria will be happy to let us know or share something in the presentation. So when it comes to providing care, first and foremost, you need to be creative, you need to have patience, and you need to have empathy. And somehow take the ability to step out of your own needs and your personal logic and again, understand why this is happening. And we can learn to successfully manage it, but it's a learning. And sometimes it's hit or miss. So as much as possible, if it doesn't work out, don't stress. Take a day at a time. If it doesn't work out today, try again tomorrow. Maybe it's going to be better. So as with most things related to dementia, caregiver dealing with behavioral symptoms requires planning. Planning is key, and poor hygiene can become a big issue. So if you start to get into this cycle of planning hygiene, the refusal, and continuous, it can have medical consequences. So we want to be aware of that as well, such as the risk of urinary tract infections, or maybe rashes, or bed sores, or even unpleasant odors. That's why hygiene is so important. Not everybody is aware, but sometimes dementia affects our sensory perceptions and changes, and with age as well. So that things like vision, touch, smell, hearing, and taste change. A tub of water might seem scary because the depth perception changes. So what they're seeing might not be the same as what you're seeing. A smelly shirt may be more comfortable than a fresh one, and water temperature may feel different for them than it feels for you. It may seem colder, it may seem hotter. So not knowing what's happening to them can make them feel very confused, anxious, and insecure. They may not hear your instructions properly, and they may be experiencing taste changes, and that can affect what they want or do not want to eat as well. So how do we get started? So interestingly, hygiene can be one of the hardest things that you have to do. And it's so basic. It's something that all our lives, it's the first thing we do when we wake up in the morning. But again, stepping back and planning can make it better for both of you. If your person is afraid of bathing, follow their lifelong habits, such as doing it in the morning. When did they do it? Or before going to bed. There's no magic, but try and go from where they always did it. Use their time and habits. One thing, again, make sure you have the time and energy to get the task done before you even get started. Prepare yourself. Things may not work out as you plan or as you wish. Be patient, use clear words. And I know this is easy to say, but try to avoid your frustration and anger building. This just sends you down the rabbit hole. Stay calm and focused. Now, of course, we know this is a very hard ask and it's very challenging. And that's why today we're going to provide a lot of tips, and hopefully amongst each other, we can share how do you accomplish these things? How does it work for you? What are you struggling with? And I'm hoping, and Lucy's hoping, that you too have your tips that you can share with us and all of us. So bathing and safety equipment, why do we talk about this? One thing, bathing, showering can be one of the most dangerous activities you do. It's high risk. Why? A fall can change everything. And this is something I always told my parents. A fall can change everything, but especially in the bathroom. Because you fall in the bathroom, you're falling on a hard surface. So the other interesting thing about showering and bathing is this is what usually brings people to their CLSC. This is usually the first request for support. We want to be safe. So two key things: never leave a confused or frail person alone in the tub or shower, even for a second. Always check the water temperature before they get in the tub or shower. We've all heard of terrible accidents when the water's been too hot. And of course, too cold, is frightening and jarring. So equipment, and you see some pictures on the right, is a must. Equipment is non-negotiable for you and even for CLSC workers. A CLSC auxiliary will never shower anyone without safety equipment in place. Some of the basic ones are a handheld shower, which you see on the top right. And it's so logical because instead of moving somebody towards the water, this allows you to move the water towards them. And it's also very soothing. Using a rubber bath mat and safety bars is key to avoid falls. And a sturdy shower chair, or sometimes a shower bench, can support a person who's unsteady. And also, if you think about it, when you're sitting, you're more comfortable, you're more in that cocooning position, you're warmer, and it's more secure. So you can get a very good assessment, even if you're going to do the showering alone, from a professional occupational therapist about how to bathe safely and what is the right equipment to either rent or purchase. So I'm going to be passing the torch over to Lucy. And she is really going to get into the nitty gritty. But I'm just going to just pause and ask, up to now, does anybody have any questions or comments before Lucy gets started? So Diane and Maria, I'm just going to ask, is there anything to share in the chat?
There is nothing yet in the chat, no. But please do feel free to post your comments. Even though the session is being recorded, whatever is posted in the chat will not be visible publicly.
And you know what? I'm going to again remind everybody too that when Lucy and I are finished the presentation at 11, we are actually adding time on after, up to a half an hour, for anybody who wants to stay on and just chat without the recording. A reminder that there's that as well. So Lucy.
Thank you so much, Joanne. Hi, everybody, and welcome. So bathing and safety tips, all right? But before we start, I just want to remind everybody and sort of let you know that it's so important to make sure that you are not too tired that day. You have to make sure to put enough time aside to get this task done. And so it is important that you yourself are ready, that it might take longer than what you thought it would. So, as you were talking, Joanne, and safety tips, it reminded me of my own mother, who when it was time to have a shower, what we used to say to her, it's spa day. And that kind of triggered something in her. And she realized that, she was really ready to do that. But I think it's very important to get everything ready before. Get the soap, the washcloth, towels, and shampoo ready. Make sure that the bathroom is warm and well lit. Put soft music if it helps to relax the person. I would highly encourage that you use music that the person really likes. That really worked very well with my own mother. Be matter of fact about bathing. Say it's time for a bath or it's a spa day. Please don't argue about that they need to have a bath or a shower, that it's time, that There's a bit of an odor. Just make it matter of fact. Be gentle and respectful. Tell the person what you're going to do, step by step. That is really extremely important. Make sure, as Joanne said, that the water temperature is comfortable. Don't use bath oil. Obviously, it could make the tub slippery and may cause urinary tract infection. If they refuse a bath or shower that day, a sponge bath may be helpful. So let's look at what happens during the bath or shower, okay? Allow the person with dementia to do as much as possible for themselves. We talked about that. It's very important for them to continue to do whatever it is that they can. This protects his or her dignity and helps the person feel more comfortable and much more in control. So here are a few other tips. Put a towel over the person's shoulder or lap. This helps them feel less exposed. Use a sponge or a washcloth to clean under the towel. So you're really kind of protecting their privacy. Distract the person by talking about something else if they become upset. Give the person a washcloth to hold and allow them to help wash themselves. Now, these are a few other suggestions that I would like to share with you. It is really important to prevent rashes or infections by patting the person's skin with a towel. Make sure the person is completely dry. Be sure to dry between folds of the skin. If the person is incontinent, use a protective ointment on their private parts or let them do it themselves. I know it's very intimate what I'm saying, but all these things are so important to keep in mind, to keep the skin really not making sure that they don't get infected or they get a rash. For most people, I'm repeating again, a full bath or shower 2 or 3 times a week is enough. Between baths, a sponge bath to clean their face, their hands, their feet, their underarms, and genitals is all you need to do every day.
I do have a question in the chat, Lucy.
Wonderful.
So we have someone who's asking at what point you should be worried if the patient has no interest in having a shower or washing their hair. So one of our guests is also concerned because they haven't been cleaned that way since being put in a nursing home. So just maybe some general recommendations on how often should the person be washed like this, and what can you do if there's a large delay in time between when they do actually get treated?
Well, you were saying that this person is in a nursing home, so I'm just kind of wondering why they're not being taken care of, and that's something maybe that you could look into. But in reality, we have to keep in mind that a lot of these people are not doing a lot of exercise, or they're not running around. So really, having a shower once or twice a week or sponge bath, I think, is sufficient, unless that they're incontinent, and you have to make sure that they're cleaned properly. So as I said before, so they don't get urinary tract infections. But just going back to if they're in long-term care, I would certainly want to ask, why has the person that my mother or my husband, why are they not been showered? Like, I think it's important for you to be a little bit more to advocate on their behalf and ask the head nurse or whoever is in charge why this is not happening. So I'm wondering, how long has this person not been bathed?
Yeah, there's just an additional comment about how a lot of the personal support workers don't seem to have training on Alzheimer's. So it sounds like they were not necessarily prepared for some of the resistance.
No, that is really a very important point. Remember that when we were talking about distracting a person, if someone is refusing to take a shower, as Joanne said, it's because there might be different reasons behind that. So I think education for help, home help, or help in long-term care is so important, to be able to distract the person, to be patient, to be calm, to be able to involve the person in their daily care as much as possible.
Lucy, can I add something about nursing home care and hygiene?
Yes, I was hoping that you would jump in.
No, just some things we do have to keep in mind is in nursing homes, for somebody who isn't able to be showered, who's really advanced, heavy care, they do have lifts, and there are special rooms where a person can be, where the trained personnel can use a lift and give a person a full bathing experience. However, there are exceptions where that experience is so traumatic for the person or so difficult. And I'm talking with very advanced um, uh, disabilities. So in those cases, sometimes, and clients that we have at home too, at times who can't be showered, they are able to be sponge bathed in a hospital bed by a knowledgeable and trained person, but you can have a full sponge bathing that can meet cleanliness needs, because there are some exceptions where people cannot be fully showered. So I just wanted to add that.
Thank you.
Thank you. I do have another comment from another one of our listeners today. I'm just going to read it because it's it's a bit detailed. So my husband has just gone into a residence, but there are a couple of things that I found useful in the time before he went in. In the beginning, I would ask if he wanted to shower, and inevitably the answer was always no. As the disease progressed, I found that he was less resistant and needed direction, always asking, "What now?" Again, the disease progressed. He forgot what to do in the shower, so I had to wash him myself and give him a lot of cues. For dental hygiene, he just flat out refused most of the time. I spoke with his dentist and she coated his teeth to help prevent extensive decay. Yeah, that's a good idea for the coating of the teeth. All right.
Thank you so much for that. I saw there was another chat.
There's just a little bit of chat about how it's a terrible disease. Coating the teeth is great. And one person's father lost 2 teeth. So obviously dental care is very important to consider. Yeah, and there's also a little bit of chat about how sometimes the residents push back and they say that, that they can't force the resident, that the resident has their own agency and that they have to think about their staff's safety as well. So it sounds like, there's not an easy situation to navigate here.
No, it's not an easy situation at all. And what I want, as Joanne said, after the hour, we're going to stay on for another half an hour and we can really get into a lot more. So thank you for all those comments. All right, so now we're going to go into dressing. I have to say this one is also a difficult thing for a lot of people. So whenever possible, I believe that to allow the person to choose their own clothes. I think a really good tip is to lay out the clothes in order the person should put them on, such as the underwear first, then the pants, then a shirt, and then a sweater if necessary. And it's also good to hand the person one thing at a time or give step-by-step instructions. So as I'm talking, this takes time, it takes patience. And so it's so important to have that time to do all this. And I think putting away clothes in another room to reduce the number of choices. Keep only 1 or 2 outfits in the closet or the dresser. I know that from my own experience with my mother, who, when there were a lot of clothes in the cupboard, she just couldn't decide which one she wanted. She kept pulling it off. So that became really easier when there was just fewer clothes. So if necessary, keep the closet locked if you need to, if they keep going into that all the time. And it's also, you could think about buying 3 or 4 sets of the same clothes if the person wants to wear the same clothes every day. There's nothing wrong with that. And obviously, it's easier to buy loose-fitting, comfortable clothes, such as a sports bra or not to wear a bra at all. cotton socks, underwear, sweatpants, and shorts with elastic waistbands. Obviously, let's avoid girdles, control top, pantyhose, knee highs, nylons, definitely no high heels and tight socks. I think using Velcro tape or large zipper pull up for clothing instead of shoelaces, buttons, or buckles. And I'm sure a lot of you have thought about that already. And there are these new things, these slip-on shoes that won't slide off your, or shoes with Velcro. So these are kind of easy tips, but believe you me, it can be very, very difficult many times to get them to really dress or to get them ready. Now, I think the other thing, we could just go for a minute back. You could group items in color or ones that are worn together, hang ties, belts, or other accessories, and a hanger with matching clothes, and obviously have a basket handy to put soiled laundry in. All right, let's talk a little bit about oral care, okay? Now, proper oral care is so important to prevent tooth decay and gum disease. Poor dental health will also affect an individual's ability sometimes to even eat, and you're not even aware of that. They're all of a sudden stopping. They don't want to eat. They don't want to drink. They might have pain that you don't know that it's there. So it's wise to have a complete dental examination early in the disease. Ask the dentist to schedule the appointment or the secretary at times where there will be no delay so that you can actually come in and have the appointment. There are some dentists that specialize in patients with dementia. And I also think that it's important to let the staff in the office know that the person you're caring for does have dementia. So I also want to talk about following tips, that this might be useful too. Now, remind the person to brush twice a day with a soft bristle toothbrush and toothpaste. Now, consider getting the person an electric toothbrush if it's easier and if it doesn't frighten them. We did that with my mom and it worked for us. Now, especially if the person has any arthritis or it's just difficult for them to move their hand up and down. Now, the other thing, you can also give step-by-step instruction or trying hands-on guidance or gestures, show them how to do it. Now, be present when the person is brushing to make sure that they're not swallowing all that toothpaste. I know it's hard to manage that, but it's also something that you could look after. Now, there's also something else. I know one caregiver told me that the easiest way for her to have her mom brush her teeth was she put a basin of water on the kitchen table. Her mother sat there and she took the toothbrush and was able to kind of help her with that rather than in front of the sink. A glass of water was handy there. She would rinse her mouth and then she would take the basin away. So whatever tip or whatever way that works for you, it is important to make sure dental care is so important for our overall health in general. So, that's one of the things that we should really try. Now, there could be some fluoride swabs if they don't want to brush. And it's so important to make sure that you also take care of their dentures, cleaning them, putting them in water, obviously, be prepared for the person to hide their dentures. That really happens a lot. So try to keep them in a specific place at all times. And again, you remove them at bedtime, make sure the dentures are clearly labeled when they're in long-term care to prevent damage. When cleaning dentures, make sure that the sink is closed and that the toilet seat, because many times it could be thrown into the toilet. If the person develops a dry mouth, try some sugarless gum, or ice cubes are really good to increase the flow of saliva. So I was wondering if there are any other tips that you would like to share or any questions that you may have.
We have a couple of comments in the chat. So one of our listeners was mentioning that in their experience, dental care is not done in the residences. So it sounds like you really have to take the initiative to advocate and do that. And then we also have another comment about highly recommending Colgate Slim Soft Charcoal Floss Tip Toothbrush if your loved one has the issue with the hardness of the brush. So apparently it's an excellent heavenly brush for your teeth. So Colgate Slim Soft Charcoal Floss Tip.
Thank you for that. So let's go back for a minute to just talk about in long-term care. It just makes me very sad to think that that's not being taken care of. And I hope it's not like a general thing. But again, as a caregiver, you don't stop being a caregiver once the person is in long-term care, that's for sure. And that's part of the advocacy role that as a caregiver we have to play. And it's important that if you do feel that that's not being taken care of, or anything else for that matter, is to be able to address that in a way that that you could speak to the head nurse, make sure that you have a good relationship with the people that are caring for the person, for your family member, so that you can engage in that. These are things that are very important to keep and make sure that their dental care is taken care of. So let's go into foot care. All right. Now, foot care is often neglected because people can no longer reach their feet as they get older, and they often can't see to provide proper nail care. It can be even more challenging with dementia. So I think it's so important to check the person's feet on a regular basis. Look for discoloration, because discoloration, if it looks like their toes are blue or any other color, there could be problems with circulation that you may want to make an appointment with the doctor. There could be calluses, bunions, other nail problems. Now, these can be really very painful, and they may not be able to tell you. So that could change their mood. They could be, they could push away when they think you're coming near them, or even thinking about showering or bathing. And it's also important to check the nail length. Be careful with nail clippers and scissors. I would, you really have to be careful. And if you're not comfortable with doing that, then you should try and get someone else to do that for you, or get somebody to come to the house. Now, after bathing, assure skin between the toes and clean and dry. Again, the drying of the skin is extremely important. Now, I have to say that opportunity to provide comfort by giving a foot massage. I mean, that's always very pleasant. It's a nice activity. And a little nail polish often brings a smile if the person would like to have that done. So these are things, as I said, you can sort of engage people as when you're doing any kind of hygiene, that it's part of something that is a pleasant thing that you can do together. Any other questions or suggestions? Because you've had such amazing suggestions before.
Nothing posted in the chat.
Okay, thank you.
Sorry, we just got one.
Sure.
Yeah. So someone was mentioning that their father resists nail care from everyone except her. So she does it while he's watching TV. It's a good idea.
Well, that's exactly what I was trying to say. All of these activities can be something that you share with the person that you're caring for. It is a task, obviously, but it's something that could be pleasant. It's something that could be something that they enjoy, and that you have a conversation around that, especially when a person has dementia, when you want to distract them or talk to them or share with them. And when I say distraction, so let's say they didn't want to have their nails cut, but you felt that it was important. So talk about something else. Talk about the kids' call today, or what the grandchildren did, or put on music. Is a wonderful way of dealing with distraction, is putting some music on, singing a song together, anything that would sort of get them out of whatever is bothering them at that particular time. But if they're really pulling their feet away, they might have a lot of pain there. So I think it is important to make an appointment with the doctor. Thank you for that tip. Okay, so clean, well-groomed hair will make a person look and feel better. We know that for sure. So it's important to kind of choose a hairstyle that's easy to care for, but that they like as well. So don't chop off their hair and making them, like if at all possible, ask them what they would like. Encourage the person to comb their own hair. If necessary, give them step-by-step instructions or a cue. For example, place the comb in the person's hand or start combing your own hair. It's also good that if washing the hair becomes a big problem, you could use non-stinging baby shampoo, so it doesn't hurt them, or try a dry shampoo. Between washing, if it's difficult to get them to wash their hair. Now, here's another little tip that's sort of a pleasant little tip. Try a scalp massage when washing. It may be soothing and they may enjoy it, and that's another way of distracting. But some people are used to going to a hairdresser or to a barbershop. So if at all possible, you can actually take them to that barbershop or hair salon where they used to go before. Make sure that the stylists are aware of the person's dementia. And I have to say, I had my own experience. I went to have my hair cut and I saw a lady come in with her caregiver, and the stylist knew. And it was just so wonderful to see that interaction. She made her feel so comfortable. Oh, and she didn't remember her name, but she recognized her face. So that's a really nice thing to be able to continue if at all possible. So if the person feels insecure, you may want to stay with them. Like if they don't want to stay in this salon alone, stay with them by all means. I'm going to share, one caregiver shared this information with me, and she said, my mom really likes fruit. I found that having a bowl of fresh fruit nearby during a bath time really helped focus her attention on something she enjoyed. As I would shampoo her hair, if she began to feel agitated, I would give her a fresh strawberry to eat. This made shampooing easier and a more positive experience for both of us. So any little tip that you can use, anything that you know, is really, really helpful. Now, when I say distract and redirect, I'm wondering, does anyone in the audience have any other tip for us about hair care?
So one comment in the chat was one of the listeners used a #1 clipper to her dad's hair because he resists all the attempts. So that makes him look pretty cool. If that's one way to go.
Okay. Thank you for that. All right, so let's take a look about some special tips for women. Now, the application of makeup may be a regular, important part of grooming routine. Now, I always tell my friends, if I stop wearing my lipstick, there's something wrong, okay? So some women really like to put on some makeup, so it's important. So obviously try to simplify it, let them do as much as they can, but make sure that they don't look over made up. And sometimes, beauty treatments, if a person was used to it, is really a very pleasant thing for them to continue. A manicure can help overall grooming and also be a source of pleasant touching and stimulation, often be given by a friend or a family member. I've told this story many times. One of my most wonderful, rewarding experience with my mother was doing her nails. I would bring in different colors. She would choose the nail polish that she wanted. We would reminisce. And before I knew it, an hour and a half would go by, and it was so pleasant for both of us. I think also, as I said before, give up on stockings and pantyhose. That's really, really important not to do that. Now, I see keep a sweaters, cardigan, or shawl handy as they can bring comfort and security. What I'm saying by that, if somebody becomes agitated, all of a sudden they might just be cold. So these are little tips that are just handy to have. Now, let's take a look at some tips for men. Now, you could use an electric razor. Might be best to shave at a regular time or at a time when the person seems most willing, which may vary from day to day. So it doesn't have to be exactly at the same time every day. Now, again, you can try a barber shop or find one who will come to the house. Now, some caregivers have said, I give up on it, let the beard grow if shaving becomes difficult. Now, you might not like that, but we really have to go with what's happening with the person and not make life too difficult. So if your loved one wants to use perfume, and I'm saying this because caregivers talk a lot about perfume after shave, continue doing so. Smells often remind us of a meaningful time in our lives, okay? However, if they resist, then don't, even though you may want them to, to smell good. So it's really, really up to them.
So, Lucy, I just wanted to share another tip because you're describing great tips for everything, from the bathing, hygiene, oral care to dressing, hair, etc. So one thing that's really nice and put a positive spin on it is to document. We've all got our cell phones. So after all this, work and experience together, it can be fun to take a photo. To take a photo of the person nicely dressed, groomed, hair done, men shaved, nicely groomed as well. And look at it together and say, wow, look how great you look. Look what we've accomplished today. And again, and if the person is not so encouraged, it might help to show a photo. Look how good you looked the last time we finished this. Look at what you were wearing. Let's do it again. Let's make another photo. So just wanted to add that tip.
I love that. That's a wonderful tip. Thank you for that, Joanne. I see there's a few others on the chat.
Yeah, there's along the same lines of what Joanne was just mentioning. So one of our participants mentioned that they like to hold a mirror up, just so that, the father can see, oh, this is how you look now. Like maybe it's time for a shave. And there was also some chat about this product called a shampoo cap. So with the shampoo cap, you warm it in the microwave and then you massage it over the head so that it cleans the hair at the same time with no water. I don't know if you've ever heard of that. Apparently they have something similar in the hospital that they use, an overrinse shampoo cap.
I love that. I just put it down. I'm going to look into that as part of my tips. You see, that's why this is caring conversation. And we like to hear your voices because your tips are so helpful to others and for us as well. Thank you.
Great. Thank you.
All right. So let's just kind of look at the final notes on hygiene. So, establish a routine around hygiene. Keep it simple and pleasant as possible. You will have a better chance of getting through it with humor. I want to talk a little bit about humor and music. That's really important. And, and as Joanne was talking, to try and see things through their lens. Now, a lot of humor and music and just being very easy about it and just doing it, talking to them and just using your own personality and theirs to just engage with them. It's so important to be patient and don't strain yourself. Now, this is an important piece that I just want to spend a little bit of time on that. Now, when you're assisting someone who needs a lot of assistance, either to get up or to get them into the shower, you have to find your boundaries. You can't strain yourself to the point that you're going to hurt yourself. That is important to keep in mind. So if things are really becoming difficult for you, I think it's time to have the person assessed again in the bathroom, but you can call your local CLSC and to see really what is the best way of either giving them a shower or a sponge bath to make sure that you don't hurt yourself. And again, remember, bath showers 3 times a week. It all depends on the person. Sponge baths are okay as well, as long as you keep the skin really, really healthy and dry. So between, as I said, as long as you're the sponge baths, the face, their hands, their feet, underarms, and genitals, all need to be done really on a daily basis. But I also want to say, I always tell caregivers that you need to take care of yourself. It's very important for your mental and physical well-being. You know, we all need balance in our lives to reduce our stress. By exercising, eating well, sleeping well, taking deep breaths, staying connected to others, and not isolating yourself. And don't forget to pour yourself a nice bubble bath and soak some of the caregiver stress away. Take care of yourself. Do something positive every single day for you. But if things get too difficult, make an appointment with the person's doctor. There may be a reason why the person is behaving in this manner. They may have a urinary tract infection, or any other medical problem that you're not aware of. Their medications may need to be changed, or maybe they got new medications that's making them even more agitated or more frail, or their dementia has progressed. Please keep in mind that if the person you are caring for has become verbally, physically, or sexually aggressive, you need to put a plan in place. Make sure you call a family member or a trusted friend to assist you. It's important to have that. Now, it may never happen, but it could escalate. If the person cannot be controlled, you may need to call 911. There are many resources in your community to support both of you. Please reach out as you're doing today. You don't need to do this alone. So with that, I just wonder if there are any comments now or any other tips. But I also want to tell you that you will have a lot of resources. A lot of what I was saying today is in the resources. And I'm just wondering if anybody would like to share some other tips with us.
So we have a tip for keeping hands clean, if they're capable, is to get them to help wash the dishes in the sink. I think that's a great idea.
I love that.
Thank you.
You know, there's all these wipes that there's baby wipes, but now there's adult wipes that are flushable that you don't have to, that you can flush down the toilet. Those are really, really good as well, to be able to give it to them and they can clean themselves as much as possible.
I thought maybe I would share a story about my dad, Lucy, since unless there's something in the chat before there that Diane, but is there anything or not yet?
No, there's nothing that I can see at the moment. No.
So I was going to come back to the word dignity, because hygiene it's such a personal act. And I wanted to share an experience I had with my father, and it was a few months ago, and it was in hospital, actually. We just went into emergency for a urinary tract infection. And he ended up being in that emergency ward for 3 days. I'm sure you've read, for those of you who are from Quebec, and I know it's like this in a lot of other provinces, even if you're not supposed to be in emergency, he was there 3 days. And by the 3rd day, it dawned on me, he had not been washed in 3 days, lying in that bed, and it was disturbing me terribly. And I asked him, and I said, would you want to be washed, Dad? And he said he would. And unfortunately, because of the personnel shortages, there was one orderly or auxiliary for the entire ward on at the time. I think it was in an evening, and the place was packed and people were sitting all over the place. There was no privacy. And I asked her, I said, isn't someone going to come, and wash my dad. And she said, we don't do that in emergency. And again, the reason I'm bringing it is because we've heard you shared today about long-term care, and we know it's not perfect everywhere, and we have to really make sure our voices are heard. But I said, but he's here 3 days. So she looked at me. I said, please, you have to help me. So she did. And, it's just a reminder that if we do take the time, we can find those angels out there in our system. And she wheeled his bed to a place. There was no privacy, to a curtain. We put the curtain all around. And together she showed me, how to do the sponge bathe with him. And we pretended there was nobody listening. And, we couldn't do music or any of those tips, Lucy, but I made it very calming for my father. And I did say to the PAB, the auxiliaire, I'm his daughter and I want to respect his dignity and his privacy. And so we did so, gently holding up a sheet when necessary and turning him. And we did the entire process. And you can imagine that outside the sheet, there were other patients and, they could hear us, but we really focused on my dad. When we finished, he felt so good. And to be honest, I, as a caregiver, felt so good that we had done this together. And just to end on a light note, when we reopened the curtain, everybody there started to clap and gave a round of applause, because everybody feels the same way. It's, anyway, I wanted to share this story about advocacy and about dignity. So important when we're talking about hygiene.
Thank you so much for that, Joanne. That is so important. The dignity part as well. Yeah.
Great. Well, thank you so much, Joanne and Lucy. So I think we're going to conclude this part of Caring Conversations. Thank you as well to everyone who participated remotely. So this part of the session has been recorded and it's going to be posted on the Caring Conversations page of our website. I posted the link in the chat. So our next Caring Conversations is going to be about dementia and inappropriate sexual behaviors. That's going to take place on October 4th at 10 a.m. We'll be sending out a newsletter with the information and it will be on our website as well.
That's on October 24th. Sorry.
October. Exactly.
20.
Is that 24th? Yes. Great. So finally, since this is a pilot project, we just want to know how you enjoyed this session. So there is a short survey. We'll be sending it by email and we'll also be posting the link in the chat. We'd like to acknowledge that Caring Conversations is supported by the Petro-Canada Caremakers Foundation. So right now we're going to take a short 2-minute break to stretch and go to the bathroom. But when we return, we're going to stop the recording and return for an off-camera discussion. Just also, as you know, Caring Conversations is a project by the McGill Dementia Education Program, which is funded entirely by private donations. So if you would like to join our mailing list to be notified about important programs and resources, please email us at dementia@mcgill.ca. We hope you found the conversation useful, and we'll be back in a couple of minutes for our off-camera discussion.
So we'll see you very shortly.